Okay guys, so in this video we'll be revising about the entire high topic of anesthesia, the things that are important for all the MCQ exam point of aspect guys. We'll be revising it with all the high notes, mnemonics, images and all the instruments that are important guys. Please before starting, please guys like, share and subscribe. We'll start now. So guys, how did anesthesia as a branch did it start guys? Okay, so what happened actually, then in October 1846, so Dr. William Morton, he first demonstrated the use of either as an anesthetic. Okay, so October 16 is the date where he first demonstrated the successful use of anesthesia guys. So day is celebrated as World Anesthesia Day. It recently went around 10 days back guys. Okay, so guys, now see, now so this and so here it was done by William Thomas Green Morton. Okay, and the agent was diethyl ether guys, and it was done for jaw tumor excision. Okay, so this was the first use of either as an anesthetic guys. So it is celebrated as World Anesthesia Day. Now coming on to see, this is the typical machine, the anesthetic machine that it looks like. See, this is the color of the vaporizer. I'll now talk about further about the inhalational gases, then we'll talk about the color coding and other thing guys. Okay, see, this is the carbon dioxide absorber. So what happens here, you have a substance known as quicklime, which is the most commonly used. So see, there is a color change. If when it gets utilized completely, that's a color change. It indicates that we need to change the soda lime. Okay guys, so see, now if we talk about the ASA physical skill, so how does they classify the anesthesia? Okay, see, grade 1, when a patient is completely normal, okay, healthy patient, he does not have any other comorbidities. Grade 2, when a patient has mild to moderate systemic disease guys. Okay, grade 3, when a patient has very severe disease, okay, that impact his normal day-to-day routine life guys. Class 4, if a patient has severe disease and is like that, it is life threatening, a patient may die anytime in the near coming days. Okay, and 5th is morbid patient who is not expected to survive, means he is so sick, if you are trying anything he'll die. Okay, and if E is added, it indicates that it is an emergency guys. Okay, now coming on to the color coding of the anesthetic cylinder guys. So this is a very important topic. I have tried to summarize all the color coding of the cylinder guys, and how do you remember with all the mnemonics. Okay guys, see, so we'll talk about the color coding and the pin index guys. Okay, so if we talk about the cylinders, they are made up of molybdenum guys. Okay, now see, if we talk about the oxygen cylinder guys. Okay, so if we talk about the oxygen cylinder, so what is the color guys? You can remember obviously, so OBV. Okay, black and white. First, every time we are talking about the cylinder body, then we are talking about the shoulder. So that is black body with white shoulder. Now talking about the nitrous oxide, that is N2O. So how can you remember it? Remember it as navy blue, means you have blue body with blue shoulder. Now coming on to the carbon dioxide. So how we can remember guys? Cargos, or you can make C into a G, means gray body and gray cylinder guys. Now coming on to the air guys. Okay, so now how can we remember? We can remember this, nowadays it's very polluted air. Just recently Diwali went away guys, so it's usually, so air is black and sometimes it is black and white, means it's black body with black and white shoulder guys. You can see the photo I tried to demonstrate using making a cylinder guys. Now talk about the cyclopropane. So how I have remember guys, if you talk about the propane, so how it is OPANE. This looks like orange also, you can make it. If you change P with R, so that is orange guys, that is orange color. Now talking about the Antonox guys. So Antonox, how can we remember? Entire blue sky is blue with some blue and white patch guys. Okay, so now can you remember guys? Now try recalling. If we talk about cyclopropane, opane, that is orange. Now think about carbon dioxide. C, you can be made into G, that is gray. Nitrous oxide, navy blue. Okay guys, now talking about the pin index system. Okay, so basically why have we come to a system of pin index? So that if you are correcting it incorrectly, the gas won't connect guys. So a pin index system is very important. Okay, see, so this is basically what happens. You have 1 2 3 on the one side and 4 5 6 on one side. So like if you get a photo and they ask you it is the pin index of which, it's very easy guys. See, this is slightly away. If it would have been 1, it would be here guys. See, 4 5 6. So where is the location of the pin? Pin number 2 and 5, that is for oxygen guys. O2 2 5. Okay guys, nitrous oxide N2O, that is 3. Okay, 2 plus 1 and 5. See, the location is at 3 4 and 5 guys. Okay, now see, it's very close, that is 1 guys. Okay, and this is again 5, air, first letter 1. Okay, 5. So you can see till now 5 is common guys. Okay, now talking about the carbon dioxide guys, remember carbon dioxide is 1 and 6 guys. And if you talk about the Antonox has 7 letter guys. Okay, so hence it is 7. If we talk about the cyclopropane, you might have remembered in your childhood that methane, ethane, propane. That propane is 3 carbon compound, hence it is 3,6 guys. Okay, so we have talked about all the color coding of the cylinder guys and about the pin index system guys. Okay. So see, now coming on to the Mapelson circuit guys. So Mapelson circuit is important topic. It may be asked in the form of a image based question guys. So see, how do you find out what Mapelson circuit it is? First, know the terminology guys. Okay, APL is at the stable pressure limiting valve or the expiratory valve guys. Okay, FG is the free gas inlet here. CT is the corrugated tube that you see here guys. Okay, and P is the patient end guys. Okay, see, now how can you find out? Okay, see, if you talk about the Mapelson A, remember the mnemonic, APL is at the patient end. So this P wala part is the patient. Okay, APL close to patient is the Mapelson A. It is also known as Magel system guys. Okay, now coming on to the Mapelson B. B means both, that is both APL and free gas at the patient end. Here the free gas was close to the reservoir guys, but here you see both are at the patient end. Do you guys notice guys? Here only APL was at the patient end guys. Now talking about C is just like B, but there is no corrugated tube guys. Okay, it is also known as water circuit guys, C wala circuit, because corrugations are absent. Now coming on to the Mapelson D. So what we have remembered in A, APL located at A. D means APL is located distally. So see, D also, how can you remember? D, if you talk about the D, you can stand for Dimag. Dimag means brain in English. Brain, you can say, also say it sounds like Bain. So Mapelson D is also known as Bain's system guys. Okay, now coming about the Mapelson E. So how can we remember it guys? Okay, Mapelson E, MEAT means it is also known as IRTPs. Okay guys, now what happens in Mapelson E guys? See, end is eliminated. So what you don't have guys? You don't have reservoir bag at the end guys, and you don't have expiratory valve known as APL guys. Now coming of the F. F means it is free. So from what it is free guys? It is free of APL. Okay, so what do we say? Free. So free comes Rees, that is, it is also known as Jackson Rees guys. And Jackson may sun come, means it is used in pediatric. So if the MCQ is asked, which is the most preferred circuit for pediatric population? It is circuit F. Second most preferred guys is the circuit E. Okay. So if we talk about the Mapelson A guys, it is used for guys spontaneous respiration. This is important from the MCQ aspect guys. B and C are obsolete now guys. Okay, but C can be used for emergency resuscitation or with ambu bag guys. D is the most commonly used, that is Dimag. Brain wala Dimag is the most commonly used guys. Dimag you need to use every time guys. E is the ISTPs, that is second choice in pediatric, and F was Jackson Rees circuit guys. Okay, hope this simplifies Mapelson circuit. Now coming on further, how do you classify the drugs used in anesthesia guys? Okay, so we have inhalational drug, we have intravenous drug guys. Okay, so how do you classify inhalational? We have volatile liquids and we have gases guys. Okay, if you talk about the volatile liquids, okay, so what are the things that we have here guys? We have, like, if you talk about the inhalational, the mnemonic is shine. Okay, so S is for sevoflurane guys. Okay, and H is for halothane guys. I is for isoflurane guys. N is for nitrous oxide guys. Okay, E is for influrane and sign D. Okay, D is for desflurane guys. Okay, so this was the mnemonic for inhalation and anesthetic guys. Okay, we know that nitrous oxide is a gas, so no confusion guys. Now if we talk about the intravenous drug guys, okay, so there are some slow acting drug guys and there are some faster inducing agent guys. Okay, so see, if we talk about the slow acting drug, so this is important from MCQ. Which drug is used for dissociative anesthesia? That is none other than ketamine. Okay guys, this is important. If we talk about the opioid analgesia guys, it is fentanyl guys. Okay, and if we talk about the benzodiazepine, you have three things important that comes, that is diazepam, lorazepam and midazolam guys. Okay, now if you talk about guys faster inducing agent, okay, so if you talk about ultra short acting, you have thiopentanol and methotrexate guys. Okay, and you have faster drugs, you may have propofol and you can have etomidate guys. Okay, this is important. Now coming on to what are the stages of anesthesia, guys? Okay, so if we talk about the stages of anesthesia, there are 4 stages. First, when you have pain relief, guys. Okay, first pain goes, pain decreases. Second, when you feel like if you take slightly higher, then it goes to excitement phase, guys. Okay. Third, you get silent, guys. Okay. Fourth, it's coma and death. Just like remember it like alcohol. When you drink alcohol, you feel like all the pain goes off. You drink alcohol to rinse off the pain, guys. Then you get super excited, guys. After super excited, what happens? A time will come when you will feel like sleeping. No, I cannot tolerate anymore. You go to sleep. And if you drink a heavy dose, you may go to coma and death, guys. Same is the stage with anesthesia. Anesthesia is almost similar to alcohol, guys. If you want to remember, just guys. See, stage 1, there is loss of pain. Patient is conscious. Okay. Now stage 2, patient has excitement. So what will happen? There will be irregular blood pressure, guys. He may experience delirium and violent behavior. Like after alcohol, you hit your head somewhere or you run here and there. Eyes become dilated and hyperactive, guys. Okay. Now stage of 3, surgical anesthesia, what happens? So basically it affects 4 system, guys. Cortical center, the basal ganglia, chordae nucleus and other pathway, spinal cord and the medulla, guys. Okay. And now coming on to the, guys, so this is the most desired stage for anesthesia. Hence the name, stage of surgical anesthesia, guys. Stage 4, if there is medullary paralysis, causes the paralysis of the medulla oblongata that has the vasomotor center, guys. So if you depress it, death may occur, guys. Okay. So see, this is basically what we talked about. First stage, analgesia. Second, excitement or delirium. Third, surgical anesthesia. 4, apnea, coma and death, guys. Okay. See, first, when you start inducing the drug to the loss of consciousness, when you don't feel, guys. Okay. Second, now he is getting excited. So pupils will get dilated and his breathings will be irregular, guys. Okay. So what are the reflexes lost now? Now he won't be able to, pharyngeal and swallowing reflex are absent, guys. Now see, third, surgical anesthesia, the place when the stage when you perform the surgery. His eyeball are fixed now, guys. His breathing at a regular rate. You know, we monitor the breathing in the screen, guys. Intercostal muscle would be paralyzed and the diaphragm would be paralysis, guys. So what are the reflexes lost? You will lose vomiting reflex, corneal reflex, laryngeal reflex, pupillary reflex, everything would be lost, guys. Okay. So see, from then we are talking about induction, maintenance, recovery. So what are these 3 terms, guys? See, induction is when you start anesthesia administration and till the time you achieve the surgical anesthesia, guys. Okay, starting to the time like when the patient is completely anesthetized, that is induction time. Maintenance, after the patient has gone into anesthesia, like the surgery will continue for 1 hour or 2 hours. So guys, the patient cannot wake up in between the surgery. You need to give a certain flow of anesthetic gas so that he does not wake up, guys. So basically that is maintenance dose, time during which the patient is surgically anesthetized. Now see, now the surgery is stopped. Okay. Now the surgery is done. So you want the patient to get up from the sleep. Okay. So what you will do, the time from the discontinuation of the anesthetic drug until the patient regains consciousness, guys, is known as the recovery period. Okay, guys. So this was basically about the inhalational anesthetic, induction, maintenance and recovery, guys. Okay. See, now if we talk about, we have already classified the inhalational anesthetic between gas and volatile liquid. Remember the mnemonic, what did I give you, guys? The mnemonic was shine D, guys. You remember the mnemonic? Now coming on to the very important thing, you need to remember the MSC of the most commonly used drug. So this can be asked as an MCQ, guys, and I'll give you mnemonics to remember the MSC very quickly, guys. Okay. So first of all, what is MSC, guys? MSC is the minimal alveolar concentration. So what happens? So it is that concentration, okay, that produces immobility. Like patient will get anesthetized and he won't move in 50% of the patient, guys. Okay. So like if you have a MAC of 1.2 to 1.3, like that is adequate MAC. So that prevents movement in almost 95% of the patient. So we need to see the drugs which has a MAC of around 1.2 to 1.3, guys. Okay. Now see, coming on to this table, guys. Okay. So how will you remember this table, guys? Okay. So how I have remembered, I'll try to tell you, guys. Try learning this way. It makes it very easy, guys. See, I remember halothane. First of all, we are talking about the smell, guys. Okay. Halothane. If you say someone, hello guys, how are you? That feels pleasant to him. So this gas has a pleasant odor, guys. No confusion. Now talking about the inflorin and isoflorin. This inflorin and isoflorin, they are isomers, guys. Okay. So when they are isomers, when two people are jealousing, competing each other. If you are healthy, then it's fine. So but they are not healthy, then it is pungent odor, guys. Okay. Now coming on guys to the safe fluorine guys. Okay, this safe fluorine, you can remember safe, that is sweet yard. S for safe, S for sweet, you can remember guys. That is, it is a pleasant odor guys when it is sweet. And like this is the most ideal anesthetic for a pediatric children. You know, children like sweet. And it is less, but it does not does not have pungent odor, so that is the most preferred in pediatric guys. Now coming on to the desflurane, you make it opposite. DES, what it mean? SED, said, means sarawa se smell. So it is a irritant odor. It will irritate and also it will cause cough and irritation to the airways guys. Now coming on to the nitrous oxide. You remember nitrous oxide is also known as laughing gas guys. So like no more confusion, it would be pleasant, it makes you laugh. So anything that makes you laugh, how can it be irritant or maybe pungent guys? So now coming on to how to remember the guys MAC guys. So I'll say how I have done guys. What I've done, N2O, that is 3 letter guys. N2O, that is, it means it's more than 100 guys. Okay, dash dollar less than 100 guys. Now coming on to the safe fluorine, SC, you can go for second guys, that is 2. N fluorine, 7 also is N and the ending, that is 1.7 guys. Okay, isofluorine, iso, I is 1, S you can make it as 2, that is 1.2 guys. Halothane, halothane is guys 0.75. Methoxyfluorine, this is very less commonly. How I remember fluorine, that is 4 into 4n, that is 16 guys, that is 0.16 guys. Okay, see, now we'll see some of the important points about the inhalational anesthetic, each of this following guys, and then I'll compare in the form of table guys, so that it makes very easy for you to recall and revise during the time of exam guys. Okay, see, now if we talk about the methoxyfluorine, it's very, because see, MAC is very less, that is 0.16. Okay, and here also I've said a point guys that I've missed, that if the MAC is very high, the potency is very less guys. And you remember what was the adequate MAC between the range of 1.2 and 3. So these drugs are more preferred, like isoflurane and fluorine, because they give a good anesthetic action guys. Okay, now see, if you talk about the halothane guys. Okay, so remember guys, this halothane, I remember what I said till now. Halothane, what was the MAC guys? 0.75. If you say someone halo, that is pleasant guys. Okay, so this is a potent anesthetic guys, but not a weak analgesic. It does not reduces the pain. Saying halo can make you momentarily happy, but not, it won't reduce the pain guys. Okay, this can be used in children guys. Okay, so now what is the problem with halothane guys? Okay, in adult, this halothane causes a topic that is known as halothane hepatitis. Means it causes problem with the liver enzyme guys. Okay, so in adult, like it's not so safe. Now talking about the isoflurane. So this isoflurane, the name indicates this is the isomer guys. Okay, of N-fluorine. So this isoflurane, this is very commonly used drug guys that we use. But the only thing is that it's a bit pungent, but it does not have no nephrotoxic, no hepatotoxic. That makes it safe to use guys. Okay, now talking about the N-fluorine guys. So this N-fluorine, what happens guys? How I have remembered N-fluorine, I have remembered ESR. Don't give in seizure, don't give in renal problem guys. Okay, it is metabolized to fluoride in the kidney guys, renal. Okay, so it has a good amount of renal metabolism, so you don't want to give in a problem with renal impairment. Contraindicated with seizure disorder, not for renal failure. Now coming on to the desflurane guys. So what I remember, desflurane, that is sarawa. Sarawa is not a good odor guys, but it has a point, it requires a special equipment. Why guys? Because its vaporizing point is almost around the room temperature guys, so you require a special vaporizer guys, known as Tech 6 guys. This is important from MCQ from NEET PG and INS set point. Now coming on to the safe fluorine guys. What was it? That it has a MAC of 2 guys, it is sweet in odor, and it has it does not cause any airway irritation, so it thinks children will love to it, so it is used for pediatric population guys. Now coming on to the nitrous oxide. See guys, the MAC is 104. MAC is very high, means potency is very less, so anesthetic action is less guys. See, a potent analgesic, pain it will reduce guys, but it won't cause the anesthesia. That is the main desired guys. Okay, and this is contraindicated in pregnancy guys, this is must know. Okay, see, halothane hepatitis I said, and remember this halothane, this sensitizes the heart. Okay guys, so it is contraindicated in pheochromocytoma. You know, pheochromocytoma is a tumor in which there are a lot of catecholamines guys, and if there is a catecholamine, there would be certain change in BP guys, fluctuation, and halothane. So you can remember halothane, all which H, heart, that is halothane hepatitis and hyperthermia malignant guys. Desflurane, I said this is a popular agent for daycare surgery, guys. Okay, and it has a pungent odor and also it irritates the airway, guys. Desflurane, guys. Enflurane was what happened? ESR, guys. So it has airway irritation, it is pungent, guys, and again it causes epilepsy, guys. Nitrous oxide. So nitrous oxide shows a phenomenon known as, guys, second gas effect, guys. This is important from MCQ aspect, guys. Don't miss it out, guys. Okay. And nitrous oxide also, what does it do? It activate the vitamin B12, guys. That can cause megaloblastic anemia, guys. That is important for the maturation of RBC, guys. So nuclear RBC won't mature, guys. So nuclear remnants would be present, guys. Now coming on, see, this is basically what we all have done. Just revise, guys. Methoxyfluorine 4 into 4, 16. Halothane, that was 0.75. High is a pungent sound, but it is a pleasant, guys. Okay. Enflurane was, guys, enflurane was how much, guys? 1.2, guys. Okay. Isoflurane, that was 1.7, guys. Ceflurane was 2, guys. Desflurane is 6, guys. Okay. Now nitrous oxide, guys, is 100, guys. Okay, so if we talk about, guys, enflurane was, guys, it was 1.7 only. Sorry, I made a mistake, guys. Okay, and isoflurane was, guys, 1.2. Okay, so see, now if you talk see the drugs that have a MAC less than 1, they have slow induction, guys. Okay, do you see? It has between 1 and 2, guys, means less than 2, 1 to 2, that is medium, and if it is more than 2, guys, you can see that it is rapid recovery, guys. Okay, see, now I'll compare about all the drugs, guys, that I have talked about in the local anesthesia, guys. Okay, see, methoxyflurane, I said it's not used, mainly used in vet doctor, guys. You can see, so it has less than 1. Methoxy is 0.16 of MAC. That is, it is slow induction, guys. Okay, it is no longer used, and the MAC is lowest among all the drug. You remember, guys? Halothane was 0.75, guys. So halothane, high is means it is non-irritant, guys, because the smell is good, guys. It is less than 1, so sweet induction. I said it is a weak analgesic, okay, but MAC is less, so anesthesia wise it is potent, guys. It can be used in children, guys. What was the side effect? HHS, hepatotoxic, hyperthermia, and it can cause in the heart arrhythmia. Contraindicated pheochromocytoma, guys. Okay, it can be used in children because it does not cause hepatotoxic and it has a pleasant smell, guys. Now talking about enflurane and isoflurane. I said this isoflurane is the isomer, guys, and this enflurane. So, but the problem with enflurane, we remember the mnemonic ESR, means it is contraindicated in seizure patient and it is contraindicated in renal failure patient. I think you can, guys, see it. It is metabolized by the kidney, guys. Okay, isoflurane is good thing. The only problem is that it has a pungent odor, guys. Rest everything is fine because it is neither hepatotoxic nor it is non-nephrotoxic, guys. If we talk about the ceflurane, sweet smell, better smell, guys. Okay, so airway irritation is not there, guys, and sweet, so bacha will use, children can use it safely, so it is used for children. Now coming on to the desflurane, that is Sarawa, that is pungent odor, guys, and it has a low boiling point, means it's similar to the room temperature, hence require a special vaporizer. Since it is pungent, guys, it can irritate the cough and other nasal passage. Okay, now talking about the nitrous oxide with a MAC of 104, guys. So I said the halothane, what was the problem? It was weak analgesic. It is a potent analgesic, but, guys, it is a weak anesthetic, guys. Now you can see, and it causes diffusion hypoxia, second gas effect, guys. It can cause megaloblastic anemia, and I said it is contraindicated in pregnancy, pernicious anemia, guys. Do you see? It is used for dental procedure, guys. Okay. Now see, now we'll talk about the important instrument that you need to know from the anesthesia per se, guys. Okay, I'll try to tell you about all the instrument that I must know, guys. Okay, now see, first of all, ambu bag. Do you ever think, we have used that term ambu for so long, did you ever think what is the full form of ambu, guys? It is artificial manual breathing unit, guys. Okay, so what happens is, ambu bag, you know, it is used to resuscitate or to ventilate a patient, guys. So see, this is the ambu bag, guys, and there is a mask, guys, that you apply on the face, guys, and you try to blow in the air inside. Hence it can be also known as manual resuscitator, guys, because you are doing it manually, guys. It is also known as self-inflating bag. This is the image, guys. Okay, so just must see. Okay, this is a self-inflating bag, and this reservoir bag contains, guys, 100% O2, guys. Okay, now talking about this face mask, you might have seen them applying face masks to the patient, guys. So how do you apply? You have a maneuver known as the triple maneuver. What do you do? Head is tilted, guys. Okay, you extend to straighten the airway and you apply a jaw thrust, guys. Okay, So this is important. So this is the face mask, guys. Now this you have seen this is known as, guys, oropharyngeal airway, guys. So what happens, guys, like you try to this is used to put inside the mouth, okay, to open the airway. So what happens, like if the patient goes into anesthesia or maybe like coma or shock, so what happens that the tongue falls backward, guys. So in order to prevent the tongue falling forward, we can use this Giddle's airway, guys. Now talking about the laryngoscope, guys. So you know laryngoscope is used to intubate the patient in order to visualize the vocal cord and so that you can insert the ET tube, guys. So there are two type of blade, that is curved blade and straight blade. How will you remember? Curved blade, that is Macintosh. Straight blade, seedha line, that is McGill, that is seedha straight. Okay, so what happens, like there is light that is put at the end, guys. Okay, so how do you insert the laryngoscope, guys? We hold the laryngoscope with the left hand, guys. Okay, and try to put the pressure upward and outward, guys. Don't put excess pressure, otherwise there are chances that you may break the teeth, guys. Okay, so what happens? Hold the laryngoscope in your left hand, insert it through the right, guys, and then push it towards the left and visualize and try to insert the ET tube, guys. Okay, this is very important, guys. This like you might have tried in your college or the simulation lab. So like this is must do. I'll soon upload a video, simulation lab video, showing how to insert a laryngoscope and a ET tube, guys. Okay. See, if you talk about endotracheal tube, so this is basically what is said cuffed, guys. Okay. So why is this cuffing used, guys, and what are the parts of ET tube? See, if you see the photo of the ET tube, guys, okay, so this is the cuff, this is the bevel end, and this one is the Murphy's eyes, guys. Okay, this is the pilot balloon that you use to insufflate the cuff, guys. Okay, this is the pilot line. This is a universal connector 15 mm that can connect to the anesthetic machine, guys. This is the length marking to know how much we have gone inside, guys. Like normally what we do, the marking that should come at the incisor, that is 22, guys. And this is a radio opaque line if you want to see on the x-ray, like if you have inserted the ET tube in a right position or not, guys. Okay, so see, we have seen universal airway connector, we have seen radio opaque line, we have seen pilot inflator bag, and see this cuff type. There are two types of cuff: high pressure, low volume, low pressure, high volume. So what do we prefer, guys? We prefer, guys, prefer low pressure, high volume. Why do we prefer this, guys? We prefer in order to, guys, so that it does not cause pressure necrosis. To decrease the chance of pressure necrosis, we use this switcher, guys. See, universal airway connector 15 mm diameter, guys. Radio opaque line to identify radiologically, guys. Pilot tube to inflate the cuff, guys. Okay, cuff, low pressure, high volume to prevent the risk of aspiration and pressure necrosis, guys. There are black lines that are seen to know the vocal cord, guys. Murphy eye to check the patency of the secretion, that it does not block the tube, guys. Okay, so see, so this is basically a plain ET tube, guys. Plain ET tube is used for children. Why is it used for children, guys? Because the narrowest part is at the like cricoid, so this tube fit nicely, guys. So what are the indication of ET tube? When you need to give muscle relaxant, guys. Okay, in patient with risk of aspiration, guys. Okay, now to provide controlled ventilation and to prolong the operation, guys. This is a tracheostomy. So basically this is done either a planned or an emergency tracheostomy. So what happens, guys, when do you do this? In ICU patient who need prolonged intubation for a longer period of time, you try to make a hole and try to insert the tracheostomy tube. In case of vocal cord palsy, guys. In case of organophosphate poisoning, guys. In chemical burn, in syndromes like GBS Guillain-Barré syndrome, guys. Okay. Now talking about the color coding of the cannula, guys. Okay, so how can you remember this color coding of cannula? I'll make it very simple, guys. Okay, so see, first of all is the orange color, guys. Okay, try to see what I'm making, guys. That would make it very easy, guys. Okay, see what I'm trying to make it. Just observe. Okay, 1 minute, guys. One minute. 1 minute. Okay, see, guys, now how I have remembered it. See, so first of all in the ground there is lava, guys. That is orange color. You can see that is orange color is the 14 gauge. Remember, it is the list one, guys. When you come to the soil, it is gray in color, guys. Okay, so soil gray color, that is ash or gray color, that is 16 gauge, guys. Okay, So remember the white, you don't mix it here guys. White is 17 gauge. Remember it like it is the odd number guys. Now coming on C, you will see when you see here guys, what happens here, you will see the presence of the green leaves on the ground, that flower that is growing. So green is 18 gauge guys. So now you see the pink color flowers here guys. So this pink flower is the 20 gauge guys. Now when you go above the flower, what you will see? You will see the presence of sky. So sky is 22 gauge. If you go above guys, okay, you will see the presence of guys sun and the other thing, that is yellow to orange color guys. If you go further above, that is 26 gauge, that is violet color, ultraviolet light guys. Okay, so this makes it I think easy. So now coming on to the nasogastric tube, as the name indicates, you are going to the gastric passage, means you can aspirate for the aspiration of gastric juices for diagnostic and therapeutic purpose and for feeding guys. Okay, so how do you confirm guys? If the tube is in the, so there may be gurgling sound over the epigastrium area. See, suck to see if the juices are coming or not coming guys. This makes it evident. Now coming on to the important thing, this is very important from image based aspect guys. This can be asked as an image. Okay, so this, what is laryngeal mask airway? It is a new type of airway device guys. Okay, that keeps the airway patent during anesthesia or unconsciousness. This is a type of guys supraglottic devices. Okay guys, so what happens, this goes inside, thus it prevents the reflux of the things inside. And this is more newer technique that is known as the eye gel guys. Okay, you might have seen getting used in your anesthesia posting or your surgery posting. This also gets used nowadays. Okay, now coming on to the capnography guys. So what happens in a capnography? This is the typical monitor screen that you see in your anesthesia posting guys. So see what happens, there are 4 phases in capnography and 2 angle in the capnograph. So what is the 4 phases guys? See, first of all, it's the inspiratory baseline guys. Okay, so first then it is the expiratory upstroke guys, then it's the expiratory plateau phase, then it's the expiratory downstroke guys. Okay, so what happens in this guys? Okay, so see, when you start guys phase 1, there is no CO2, that is completely devoid of CO2. You can see the baseline guys, it's starting from 0, CO2 trace should reach 0. Now when you go inside guys, okay, so there would be mixing of the dead space gas and the alveolar gas, and the angle, it is known as the alpha angle guys, when there is a transition from dead space to the alveoli gas, that is almost guys 110 degree. So okay, now coming on to the alveolar part of gut, they represent the plateau average of alveolar CO2 concentration guys, when they have gotten mixed. After that there is more CO2. Now this end expiration, they represent the maximum alveolar CO2 concentration guys. Okay, that is the, it is the beta angle actually guys. Okay, beta angle is the 90 degree guys. Then comes the downstroke guys. So this is the inspiration part of the graph, and the remaining curve that you see is the expiration part of the graph guys. Okay, so see, so there are few different appearances that you may see. Okay, see here what happens, the plateau is curved, looks like a shark fin appearance guys. So when there is a spasm, okay, so there is in asthma and in COPD guys. Okay, now coming on to the increased ATCO2. See, if the patient is ventilating less, means less amount of CO2 will come out of the lung. So there is increased CO2. Hence there is slow heart rate guys. See, you can see it has taken so long guys. Now when there is decreased A2CO2, means CO2 is less in the lung when the patient is hyperventilating guys. Okay, so you will see there is rapid rate guys because it is slow. Then variable waveform when the patient is in intermittent apnea guys. Okay, so see, ETCO2, end tidal CO2, the normal pressure is 35 to 45 mmHg guys. Okay, and this is used as first indicator for the diagnosis of malignant hyperpyrexia and to know whether you have put the correct placement of ET tube or not. If you have gone in the esophagus, it would show changes in the end tidal CO2 curve guys. Okay, now coming on to the very important aspect, that is the pulse oximeter. You might have heard the popularity of pulse oximeter during the time of your COVID, like how important it is guys, pulse oximeter. So what does it detect guys? It detects the oxygen saturation of the hemoglobin. So basically it works on the 2 principle. It is a non-invasive procedure, you know, just keep your finger between the device and it tells you guys. Okay, so what happens that this detects only the pulsatile blood guys. Okay, see, you can see in the photo there are 2 types of LED. One is the red LED, one is the infrared LED guys. So what happens, both have a different wavelength. This red LED has a wavelength of 660 nanometer, while this infrared LED has a wavelength of 940 nanometer guys. Okay, and it works on the principle of Beers-Lambert law guys. This is very important from MCQ aspect guys. Okay, so you need to remember which one works how. See, if you talk about what how you can remember it like a sexy darling guys. Okay, so that is sexy, that is 6. Okay, at 600 wavelength guys. Okay, that is red light guys. Okay, at 600 wavelength, darling, that is deoxyhemoglobin, absorbs the red light. So now how will you remember other one? Instead of deoxy, 950 wala will be oxy, guys. Okay, instead of red light, it would be infrared light, guys. Okay, so remember sexy darling means at 600 wavelength, deoxyhemoglobin absorbs red light, guys. So this makes it very simple. Okay, so now coming on to the other important like one liners in anesthesia. So if you talk about the daycare surgery, drug of choice for induction is the propofol, guys. So what are the mnemonics for the drugs used in daycare surgery? So we know our time was there when Manmohan Singh was the prime minister, guys. So Manmohan Singh is the prime minister. M for mivacurium, S for succinyl chlorine, I for isoflurane, A for L-fentanyl, P for propofol, M for midazolam, guys. Now coming on to the liver failure, I said it is contraindicated in adult. Why? Because it was causing halothin hepatitis, guys. So we cannot use this drug, guys. Okay. So what are the drugs used? Isoflurane may be used, and neuromuscular blockade like cisatracurium may be used. In renal failure, remember what was not used? Methoxyflurane was not used, guys, and enflurane was not used, guys. Do you remember? Morphine is not used. So what are the drugs that can be used? Isoflurane, halothin, and desflurane, guys. Okay. Now status asthmaticus. Children we use halothin, and in adults we use ketamine, guys. Pediatric most best is the sevoflurane. How we remember? Sevoflurane has a sweet smell, hence the children will prefer it, guys. Okay. So this is the most preferred in pediatric population, guys. Okay. So guys, hope this helps you revise the entire anesthesia and least possible time possible with all the hide images, content, mnemonic, MAC, local anesthetic, and other important instrument discussed. If you like it, please like, comment, share and subscribe, and do comment which subject do you need next for rapid revision. Hope this helps you guys. Happy learning, guys.